You made a point earlier saying that, how the shoulder could be difficult, which it is. And by design for those listeners, and just a reminder to our students and stuff, shoulder is considered the most unstable joint in the body anyway. So, you know, that's why it gets tricky sometimes. And everything has to work properly for it to fire and hold up into that socket. You know, the labrum is a soft tissue like your nose or your ear, and that makes up 90% of the joint right there, that glenohumeral joint. So all the other rotator cuff muscles around it have to be stable and strong enough to help hold it into the socket. So it's a tricky, that's why shoulders are not as easy as people would think.
Yeah, and on the preventative tip, I try to explain to people if they're not aware, just exactly what you said. Our shoulder and our hip are the only ball and socket joints in our whole body. My elbow is a hinge joint, meaning it just goes one way. It bends this way, it bends this way. It bends up, it bends down. It doesn't have any side to side really. Our shoulders are ball and socket joints. So with that extra mobility, which is what we need in our shoulders and we need those in our hips, comes the instability. Because it has so much mobility, by definition, it has an increased amount of instability. So knowing that, we might want to keep this little ball and socket from our shoulder into our glenohumeral joint. We might want to keep that thing tight and strong before we have an issue. Like if this thing's tracking and it's like tracking a little bit and it's slipping and like this one tendon's weak and now it's shifting more posteriorly because that's weak, or it's bringing more anterior because you're rounded shoulder. If there's an imbalance there, you can have an imbalance and not have pain, is what I'm trying to say. So I have people that come in and I'm like, yo, your shoulder, does it hurt? Well, it's on its way to hurting. If it doesn't hurt now, it's
Yeah.
trending towards that. It's no different than if you're driving a car on the freeway and you're in the middle lane, and now all of a sudden you're in the right lane, and now all of a sudden you're on the white line, and you're going tuk, 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 as you're hitting those little bump things. It's like, bro, you're swerving. Pretty soon you're going to be off the road. So do you want to wait till you're off the road, till you're in the dust and you're blowing your tires? Because I'm
Yeah.
telling you, you're swerving. And so I've had some pushback on some patients who are like, well, it doesn't hurt. And it's like, well, you got to rehab this because it's going to be a problem. And so to take it back, like if last August I would have tested him in that manner, maybe it would have shown up, or maybe it was just strictly due to the ideology of the fall. But it's something that makes me think for this season, it's like, yo, I need to check certain things on certain people.
Yeah.